I'm Valerie Costa, and welcome to Let's Chat. We would like to give a huge thanks to our sponsor, River Valley Community Bank. Today, we're speaking with Grayson Davenport, owner of Best Policy Insurance. Welcome, Grayson.
Hi there.
So, tell me about Best Policy Insurance. What is it that, what kind of services do you provide?
We are Nevada County's guide to Medicare supplements, Medicare Advantage plans, high G plans, and drug plans.
So I imagine you have quite a bit of business since we do have a very high retirement population per capita. So how does that work? How do people find you?
Well, I am available to come to people's houses. I have a lot of word of mouth. I'm coming on the show, of course, to let people know that we are back in business. We were never entirely gone, but people were preferring to stay at home during the pandemic rather than come to our presentations. And I understand. It was scary, unusual times.
Yes, it was. And if I remember correctly, you have those at Margaritas. Is that right? Or you used to? Do you
We
still
did have those
them?
margaritas. We did, yeah. Yeah, we're now looking into a new venue, and we're possibly going to be at Roundtable, but there are other possibilities.
All right, pizza's always good. Mexican food, pizza, these are some of my favorites. Sadly, I can't get Medicare yet, so I have to pay a lot of money for insurance. But so tell me a little bit about Medicare. I know that there's always things shifting and changing, and the whole drug price negotiation thing, which I haven't been paying much attention to because it doesn't affect me, but I'm aware of it. Why don't you tell us a little bit about what people need to know about Medicare?
All right, yeah, that I can definitely do. Now, Medicare is, of course, a government-sponsored health plan. It started in the 1960s. They realized, due to technological advancements, that there was a problem. Our seniors were going into the hospital for a life-saving treatment, and they were leaving alive, but with their bank accounts empty. Yeah, this wasn't going to be a thing anymore. Congress decided that they could not be the way of the future, not in this country. So they created Medicare. But Congress, being Congress, even when they do the right thing, even when they do a good thing, they don't do a good job of it. So they reconvened and they introduced new legislation and they created a second program. That's why you hear about Medicare Part A, which is inpatient care, and Medicare Part B, which is outpatient care. And when they're combined, they're referred to as Original Medicare. Two different bills, two different programs, but they are Original Medicare.
Gosh, I wish that they would have it so that people under 65 could leave the hospital and not be completely broke, but maybe someday. So the Original Medicare, so what's provided now? I mean, what if you are getting ready to turn 65, that's the age, right?
Most people 65. We also help people with certain disabilities and certain health problems, but generally speaking, it's people that are turning 65, yes.
So when you're turning 65, do you automatically get enrolled? What do you have to do to get on Medicare, and what do you need to know as you're doing that? I imagine, like any government program, there's a lot of paperwork, and gathering of your paperwork, and it's a giant pain in the rear end.
What I recommend people do is when they are 6 months till they turn 65, when they get to 6 months before turning 65, they call the Social Security office in Auburn.
Okay.
And tell them they're getting ready to turn 65, and they talk to them about what it's going to take for them to get enrolled in Medicare, or if it's going to be automatic.
Okay.
And that's how you get the ball rolling.
So for some people it's automatic, and for some people you have to enroll?
And some people, they choose to delay.
Okay.
There are people that work after the age of 65.
Lots of them.
Indeed.
And so if that automatic enrollment, or that thing that you enroll for, that basic, what does that include? Do you get like your doctor's visits and anything covered? Like, how does it work?
Well, it's not so much a matter of what you're going to get, but what the government overlooked that I'm involved in.
Okay.
So yeah, I don't have memorized what all they do cover, but they do cover quite a bit. It's I like to compare it to a free car with all the bells and whistles. It's missing its windshield.
All right, an important piece.
Yeah. And that's where the supplements or the Advantage plan come in.
Okay.
Yeah.
So tell me about those. I'm assuming that there are different tiers of those and that they cover different things at different levels.
Yeah. Yeah. Well, Medicare supplements are a standardized program. It's no different really than the government saying that it wants a certain part made by Lockheed Martin for one of their jets. Mm-hmm. Yeah, they're going to want a specific standardized part, sizes, done the way they want it. Mm-hmm. If an insurance company wants to provide supplements, they have to make a product the government approves of, and that's why I have standardized plans. We have, in this county, G plans, N plans, and there are others, but those are the two that I'm most familiar with.
So what is the G plan? What does that do?
I would describe that as the great plan.
The great plan.
No,
G for great.
I'm playing. I don't go with that. No, they're all great.
Is the N the not so great plan?
No. You have any idea how personalized it can be? One of my parents has a G plan. The other has an N plan.
Oh, okay. So what is the G plan? What does that do?
Oh, pretty much you pay a certain amount every year, and after that, you pay your monthly amount, and everything is taken care of.
Everything?
Everything that Medicare and the supplement plan covers, I would have to read to you from a very long sheet to get into it.
Does that include your eyes and your teeth?
Oh, now that is a difficult one because some plans cover them, some don't, and in order to get into more details, people actually have to talk to me.
Oh, all right.
It's all very, they don't want this talked about, they don't want this talked about. I don't know how I got to this point, but sometimes when I look at the rules and regulation, I realize that this came out of a good place. All of this. You can see that somebody wanted to make sure that nobody was left in the dark, confused, or taken advantage of. Mm-hmm. So I understand the bureaucracy, for the most part, is coming from a good place.
Mm-hmm. Like most laws. Mm-hmm. And then give it enough time, and it tends to get a little wonky. So that's the G plan. What about the N plan?
The N plan, remember the theoretical paperwork I talked about before? Mm-hmm. The N plan is about 3 times longer.
Oh, geez.
But there are advantages to both, and there isn't a right plan, wrong plan, good plan, bad plan. There's only what fits the customer. In this regard, I'm a financial tailor. It's what they need at this moment, and I help them sign up for that. I help them pick the one that they want and need.
So I know that for different people, there would be like different prices probably, but what's the range that people are going to pay? So Medicare itself is completely free, right? If you just go with the basic without the windshield.
There is an amount you have to pay for Part B. I understand that even the Amish have to pay that.
Oh.
Yeah, it's not a huge amount though, unless you're a millionaire.
Ah, yeah.
It's very reasonable. As for prices, they range depending on what state you're in, what county you're in.
Let's say you're in Nevada County. What's the range here in Nevada County?
Well, I can get people a good plan under $200 for the most part.
Well, that's very good.
Most people, it's a good thing that I can do that. One of the things that people see oftentimes, and I don't understand, is they'll see an ad on TV talking about how call this number and you can get this, you can get this, you can get this. Those ads, are coming out of Sacramento. Yeah, they are advertising to people in that county. We are not in Sacramento County. We're not in an adjoining county even. We are in Nevada County. Yeah, only making it more complex is you have regions where the rates and what is and isn't available are completely different. So you take LA County, I have heard people claim that you can get Medicare, I can't remember which plan it is even at this point, but you can get a plan for free down there. I don't know if it's true, but they tell their friends that this is a thing and then they go looking for it, and sometimes they find something good, sometimes they don't.
Yeah.
Yeah.
So that's kind of strange, since it's a federal program, that it would vary not just from state to state, but from county to county. And of course, us in the rural counties get screwed for some reason. Is it because of the less collective bargaining, or what is the reason? Less doctors?
Oh, the Medicare itself is standardized. It's the other parts that get complex. One of the things that is happening, you actually were too far off. The fact we have lower population density makes it so that we have less customers, we have less doctors, less hospitals. They're not competing with each other. There not a lot of them. Right now, I understand this county doesn't have a proctologist.
Oh.
Yeah.
That's disturbing, considering, like I said, the large amount of retired people we have spending their golden years here.
Yeah, I would recommend anybody out there that doesn't have an insurance plan to get one and go in, do an annual exam. Physical, don't not have a primary care physician. That's what I'd recommend.
Don't not have a, and this is a little off topic, but it's really hard to find a primary care physician. My husband just moved to a different job, and they decided to get insurance, and he can't find a provider that's accepting new patients, even though he's insured. So that's an issue that no matter how old you are, you're dealing with here in Nevada County, which is really too bad, considering, like I said, we have so many elders who have decided to make this their home. Yeah. So it seems like it would be a good place for doctors to come.
Indeed.
But what do I know? I'm not a doctor.
Yeah. I was actually in Sacramento County a few weeks ago. I happened to speak with a physician, and I felt the need to encourage him to move to Nevada County.
Well, I know that I just did one of these with Dignity Health, and they are working with, I think, Placer and Sacramento County to bring more physicians to the area. And they have like a program where you can work in the like rural areas, and they're working on it, but you can't force it. You can't like kidnap them from like LA and say you're going to live here now.
Indeed. There are, of course, programs to encourage doctors to go to rural and underserved areas, and we might actually qualify as those at this point because we have lost physicians during COVID and after COVID.
I think everybody lost physicians during COVID and after COVID. I certainly wouldn't have wanted to be a physician or a nurse or anywhere in the healthcare industry during that time. It seems like it was very hard on them.
Yeah.
But it is a profession that pays a lot, so.
Indeed. I managed to force myself to visit a family member who was ill at the hospital once during the worst part of the pandemic. It was a very tense place at the time. Yes. I feel nothing but sympathy for the medical community that work in hospitals during that whole thing. Yeah.
Just trying to do their best and having to deal with so much. Okay, so what else should people know about Best Policy Insurance, or about Medicare, or about you, or?
We're local, reliable, moral. We would rather get people the best product than increase our profit margin. Yeah, we aren't based out of another state. I have encountered people that they get their information from somebody that's out of state, and I had to ask them, are they telling you what's good for the whole state? Because it's possible that they're trained to do that. They could be saying what's good for LA. It does, after all, have a population the size of Ohio.
Yes.
So, yeah, what they're telling you might be true and best in that area, but not up here.
Yeah, it's a very different world here from LA. I grew up in the LA area, and I can tell you this is a different world, which is why I'm here.
We were talking earlier about Carpinteria Beach and how beautiful it is.
Carpinteria Beach. Yeah. I love Carpinteria, which is in Ventura County, if I'm not mistaken.
It is.
Which is just north of LA. I mean, it's all basically the same big thing. Southern California beaches. I do miss that. I do miss the beaches. Our beaches are beautiful, but not as suntany and swimmy. Still lovely, though. Still lovely. Okay, so if someone wanted to get in touch with you and schedule a consult, how would they go about doing that?
Now, that's a great question. My phone number is 530-575-7099. Again, that's 530-575-7099.
Website?
I have an email address, which is grayson@bestpolicyhealth.com.
And is that Grayson with an A or an E?
That is a great question. I love it when people ask me that. It's with an A.
Grayson.
Grayson.
Yes. Grayson.
Mm-hmm.
And do you have a website?
We are trying to overhaul the one we currently have.
Okay.
It was really good when it was first put together, and it has rather stagnated at this point in terms of quality.
Yes, I understand. Those things move very quickly.
Mm-hmm.
And anything else that people should know?
Well, you mentioned earlier drugs. I do help people pick drug plans. That is something I do for free for my clients.
That's very nice.
I don't know what is happening currently with the government directly negotiating with the drug manufacturing companies.
I think that just started, if I'm not mistaken.
Yeah, I am in favor, of course, of things like insulin being reasonably priced.
Yes, I think we can all agree on that, unless we're a pharmaceutical executive, in which case.
Yeah, I have known people that they literally will die without it. So
Yes, I have too.
Oh.
So it's a good thing that's happening.
Mm-hmm.
So what you're saying is you'll be a drug dealer for free if they sign up with you.
Unfortunately, not the fun kind,
No,
just the
not the
kind
fun
that'll
kind.
let you unwind, relax your mind, and enjoy your golden years.
All right. Well, thank you so much, Grayson, for coming and talking
thank you,
to
Valerie.
me today. This was Grayson Davenport with Best Policy Insurance. Thank you so much for joining us. Join us next time when we come back to Let's Chat.